Hi there, Dr. Tolson here with another episode of Vet Talk. Today we're going to be talking about cruciate tears. Now these are known as a few different names that you can see here. A cruciate, as most people might refer to it. You might also hear an ACL tear. That's the human term. That's what a lot of people are also familiar with. You might also hear your vet call it a CCL. These are the exact same thing, it's just we use different letters in veterinary medicine than they do in human medicine. But they all talk about the same thing, which is this ligament right here. Pretend this is your thigh bone, the femur, and this is your shin bone, the tibia. You can see very clearly why I did not go to art school and decided to do veterinary medicine instead. And then this is our kneecap right here. And this line that's going forward to the front of the tibia, that is this ligament here. That is the anterior cruciate ligament or the cranial cruciate ligament, whatever you want to call it. And its job is to prevent this shin bone from moving forward. If I were to snap it like that, now you can see that that tibia doesn't have anything holding it back. Now, what do we generally see with this in veterinary medicine? Generally, this is going to be a dog condition. In fact, it's almost exclusively in dogs. Cats can get it, but I've never seen a case of that in my life. It's almost always going to be a dog, and these are usually going to be the young athletic dogs. Just like with people, these are usually happening in 20-year-old college athletes tearing their ACL. Same thing in dogs. So your typical case is going to be a young Labrador retriever chasing a ball, or a German Shepherd that's running around the yard. But it can happen in any breed of any age, but that's your typical case. Now, how do we diagnose this? Usually it's a couple different things at the same time. First off, we do a physical exam. We see that this dog has a sudden hind limb lameness. Now, a good little phrase to remember is any new sudden hind limb lameness is a cruciate tear until proven otherwise. It's just that common. But on exam, we will see that it doesn't look like it is obviously swollen like a broken bone. We don't see that the hip is obviously dislocated or anything like that. And so we've ruled out some of the other things. And then from there, we usually need some sedation just because this is a painful type of thing. We do a few different orthopedic evaluations trying to see if we have this instability here. One of the things we check for is called a drawer sign, drawer like a desk drawer that you pull out. And we're seeing, can we move that tibia forward as if it was a desk drawer being pulled out? If we can get that, as well as have some very specific findings on x-rays, then we have a diagnosis of a torn cruciate ligament. Now, how do we treat this? Surgery. Surgery is the best way to treat a torn cruciate in dogs. Without it, your dog will, not maybe, but will not only have discomfort, but it's going to have a lot of arthritis later down the road. So surgery is absolutely the best way to treat this. And the best surgery for this is the TPLO. That's an acronym that stands for Tibial Plateau Leveling Osteotomy. Try saying that 10 times fast. If you're looking to gain more information on this, there is a website who our mobile board certified surgeon, Dr. Kelly Might, runs called tploaustin.com. I encourage you to go visit that website because it will have a lot more information on this procedure and as far as what to expect post-op from this. But the TPLO is something that we have Dr. Might perform here in-house, and it prevents you from having to go out of town, go to a specialty hospital. So it's a lot easier for you, and it's also going to be a lot more affordable doing it here in-house. But what they do with this procedure is that they make a cut at the top of this shin bone, and they reposition it, and then they place a plate and screws, and that will help stabilize the joint. It works really well. My own dog has had this procedure, and I can't rave about it enough how successful it is. The only thing to keep in mind though is that once a dog tears a cruciate on one leg, usually within about 2 years, they're gonna have a tear in the other knee as well. It's just that common. So financially, you need to prepare yourself. Once you are paying for one surgery, start saving up money for another one. I promise you, you're gonna thank yourself later for it. So if your dog has a sudden hind limb lameness and you're suspicious it could be a cruciate tear, give us a call or visit us online at manshackvet.com and schedule your appointment. That's it for today's Vet Talk. We'll catch you next time.